My name is Reverend Dr. Zorina Costello. I'm employed by the Center for Spirituality and Health at Mount Sinai, Icahn School of Medicine. I'm a chaplain with the Department of Spiritual Care. I've been working during the pandemic alongside my chaplain colleagues, providing spiritual care to patients, families, and staff members. During this time, a lot of my work has been with Spanish-speaking patients and families, as I'm the only chaplain in my department that speaks Spanish. It's a time of great stress for them, fear, confusion, where normally my work as a chaplain would be at the bedside. We can no longer do that, and neither can the families visit their loved ones who are hospitalized. So they look to the staff, and myself included, for that connection with the patient to be able to maybe have a Zoom meeting with them or to have discussions with the interdisciplinary teams. And so I'm called upon by the teams throughout the hospital, in the ICUs, the heart hospital, the palliative care team, to work with many of the Spanish-speaking families to help them with their stress, their sense of fear, confusion, their sometimes grief, because I also make bereavement calls. So I consider this work meaningful and important, and to be able to be alongside of the families. I also do work with the staff to help them have a safe space to talk about their own, sometimes isolation when they're not at work, and they're being separated from their own families in order to protect them from the virus. During the pandemic, there's been a huge pivot towards using the media, such as Zoom, Facebook, and Twitter and Instagram and other outlets, to be able to keep our connectedness as human beings. So although we must be physically isolated from one another, we do not have to be socially, emotionally, and spiritually isolated from one another. And I think through that connectedness, we see throughout our own health system and throughout the city the major importance of remaining connected to a community. That gives us hope, and it gives us a way in which we can continue to express our own humanity. During this time, I've been involved in my own self-care, in order to keep up my own spirits by providing meditation to staff members. During this meditation time, I'm connected with people, and I'm leading breathing, visualization, and the opportunity for people to reduce their stress through these activities. So that helps me as well. I also ride my bike with my granddaughter and my daughter whenever we have time, when the weather permits, so that we can all get some fresh air and some sunshine. Also, my faith community is quite important to me. I participate in worship services on Sundays and at other times during the week. And of course, I have my own personal prayer life. It's important to me to be able to connect with people, even when they don't profess a faith. I still want to be able to provide emotional care if they are connected religiously or spiritually affiliated. I want to be part of the team that gets them the services that they need. And so it's important during this time for all of us to know that we're in this together, and that we need each other, and that we're here to support each other.